talking about trachoma. Trachoma is a chronic conjunctivitis. It is a chronic conjunctivitis. It causes subepithelial fibrosis. Subepithelial fibrosis. Okay. The hallmark is follicle formation. What are follicles? Follicles are lymphocyte aggregates. Lymphocyte aggregates are called as follicles. As per WHO, 5 or more follicles in upper tarsal conjunctiva is pathognomic of trachoma. For diagnosing a glaucoma, for diagnosing a trachoma, the definition is 5 or more follicles in the upper tarsal conjunctiva is the definition for WHO trachoma. Okay. Apart from this, there is pannus. What is pannus? Pannus is vascularization. Vascularization is pannus. Herbert follicles are limbal follicles. Herbert follicles are limbal follicles. These are sago grain. Okay, what do follicles look like? Follicles look like sago grain appearance. Okay, when the patient rubs the eyes, these follicles tend to fall off. These follicles fall off and they give rise to appearance like this. This is what is called as Herbert pit. Herbert pit. Okay, easy to remember. Herbert. T is seen in trachoma. Remember this. Okay. Now, I was telling you trachoma causes subepithelial fibrosis. This fibrosis is visible like this. This is what is called as Art's line. Art's line is scarring in sulcus subtarsalis. Art's line is scarring in the sulcus subtarsalis, which is there. Okay. Because of this scarring, there is entropion, trichiasis, okay, symblepharon, dry eye. There is loss of the tear glands leading to dry eye. Symblepharon is adhesion of the conjunctiva with the eyeball. Adhesions are formed, and entropion, trichiasis, because of the scarring in the conjunctiva, the lid and the eyelashes tend to turn inward. This is what is pathognomic of trachoma. Okay. Now, trachoma is a chronic disease. Is a chronic disease. The sequelae are seen 20 years or later. What are the sequelae? As I was telling you, trichiasis, entropion, these are all sequelae. Okay, symblepharon, dry eye, tylosis, these are all sequelae. Complication is only one. Complication is only one. What is a complication? Complication is given to something that should be avoided. Sequelae is something that is a part of the process. You can't avoid it. Okay, they are part of the process. Complication is something that should not have happened. What is the complication? There is only one complication of trachoma, that is corneal opacity. That is corneal opacity. We should be able to avoid corneal opacity at all costs. Okay, that is a complication. Okay, treatment of trachoma is by safe strategy. S, surgery. A, antibiotic. F, facial cleanliness. And E, environmental hygiene. Okay, and WHO has given GET 2020, which is global elimination of trachoma, which was given. Okay, antibiotic of choice is azithromycin. This is the drug of choice which was there. Okay, so this is what is trachoma. What are the inclusion bodies? What are the inclusion bodies? Inclusion bodies of trachoma are HP bodies. These are Herbert, Stater, Provaziki bodies. These are the intracytoplasmic inclusion bodies which are there. This is for trachoma. Okay, these are there. Now, next disease that we will talk about is ophthalmia neonatorum or neonatal any discharge from eye of newborn in first month, that is in first 4 weeks, is pathological because tear production does not start before 4 weeks. So the any discharge is pathological. So what are the causes? Causes are chemical, bacterial, gonococcal, herpetic, and chlamydial. Okay. Earlier, gonococcal was most common. To prevent gonococcal, because gonococcal was so severe that it used to lead to vision loss. So, to prevent gonococcal ophthalmatorum, we used to use chemical. What was the chemical that was being used? It was 1% silver nitrate. This was called a Crede's method. This was the Crede's method. But by itself, chemical used to cause ophthalmia neonatorum, that was there. Okay. But now, since gonococcal is under control, we have ceftriaxone, we have good antibiotics to keep gonococcal under control. So, the incidence has gone down, and similarly, the chemical is not being used nowadays anymore. Nowadays, what are common are bacterial and chlamydial. Chlamydial is now the most common, otherwise bacterial, and herpes HSV2, which causes below the waist lesion, is also a common cause which are there. But most common now is chlamydial, which is there. Okay, so this is ophthalmia neonatorum. Please.